Hello, and thank you for joining me tonight. I'm so happy that you would take time to join me to hear what I have to say about high blood pressure. If you're here tonight, I think it's probably because you've noticed your blood pressure is creeping up and you're hoping not to have to take blood pressure medications, or you have been diagnosed with hypertension and told that this is something that you're going to have to take, medications that you're going to have to take for the rest of your life. And, or you could just be a person who's already on medications and you don't like the side effects or the cost of your therapy. So I'm glad that you joined me, and I want to share a few things with you. First of all, let me just tell you that I am creating an online course on how to lower your blood pressure without medications, and I'm going to show you how you can access that. Just go to my website, and you will be able to um, sign up there. Go to my website, go to shop, and you can sign up there. And this is what it's going to be covering, and I'm going to use it as an outline to briefly talk to you about how you can lower your blood pressure without medications. First of all, I want to tell you that blood pressure is created by the force of the heart pumping blood through the arteries. The arteries come right into the top of the heart on the left side, and they go all over the body. When the heart pumps, the blood pressure that's first created is called the systolic pressure. The systolic pressure is the top number of your blood pressure writing, um, reading that is written as a fraction. The bottom number is the diastolic pressure. The diastolic pressure is the pressure in between heart contractions. So when the heart has already contracted, push the blood out, it relaxes to allow more blood to come in preparation for the second or the next heartbeat. That period of time when the heart is relaxed and waiting on the blood to return is the diastolic pressure. What I'm going to do is skip down to some of the things that I want to make sure we can cover. For example, high blood pressure is defined according to different organizations. So some organizations are still using a systolic blood pressure of 140 and a diastolic blood pressure of 90. But I have moved to the organization that defines hypertension as a systolic blood pressure of 120, and it goes in different stages. When you are at a diastolic blood pressure of greater than 80, you have another stage of hypertension. The reason I did that is because when your blood pressure reaches 120 over 80, you are at risk for cardiovascular disease. So, what does that mean? You have an increased risk for heart attacks, strokes, and kidney disease. One of the saddest things that I have seen in my medical career occurred when I go to the dialysis unit. I see so many people of various ages, some of them in the prime of their lives, they're on dialysis. And many of those people had high blood pressure that was not controlled over a prolonged period of time. High blood pressure affects millions of people all around the world, and it's very common here in the US. And of the people who are diagnosed with high blood pressure, about 25% don't have control of their blood pressure. One of the things that I learned in preparation for just taking care of my patients who I refer out for the management of their high blood pressure if it is not related to a sleep disorder is that putting a person on the first step, which is a diuretic, is not a guarantee to lower that blood pressure into the normal range. I have a lot of patients that call me and say, well, the doctor wants to start another medication, but I don't want to take it. This is because the step approach requires you to make lifestyle changes. If your blood pressure doesn't come down and you stay at stage one, then a diuretic will be added. If your pressure still doesn't come down, another medication will be added. And if it continues to be elevated with two medications, then a third medication or a higher dose or switching to a stronger medication would be the therapy most commonly chosen. And what happens is these medications have side effects. Sometimes people come in for a sleep disturbance, and the disturbance isn't obstructive sleep apnea syndrome, which can sometimes manifest as nighttime coughing. The side effect is the coughing is a side effect of their medication. I also have lots of people who are having compromised quality of life because they do not have the ability to enjoy intimacy. High blood pressure and sleep apnea both compromise the small vessel circulation and can cause erectile dysfunction. But once we correct the sleep apnea, if it hasn't been a long time and the person is not able to maintain the type of blood flow and erection that they would like to have, you start looking at what could be causing that. And quite often it is the medications. So the medications that's used for high blood pressure control are divided into several different classifications. We have them as your diuretics, that's your first line medication, beta blockers, which work by slowing down the heart. You have some medications that work to block hormones or the enzymes that change some of the hormones made in the liver, the lungs, and the kidneys. It's like a system called the angiotensin renin system that is blocked or altered with some medications. We also have medications that block the flow of calcium into blood vessels. And these are your calcium channel blockers. Those are the medications commonly used: the ACE inhibitors, calcium channel blockers, diuretics. I don't see a lot of people using beta blockers because of the side effect, but some people who have other chronic illnesses, the beta blocker is the first drug of choice, and that medication can cause some very undesired side effects. So let's jump down to some of the things that we can do on our own to lower blood pressure. The dietary approach to stop blood pressure is called the DASH diet. Now, this DASH diet was created by the federal government and it is available for free. You will see lots of versions of it which have been modified and are now for sale. But if you want to get just the DASH diet, which is DASH, you can get that. Just put gov.gov at the end of your search so that you can get the free version um, published by the federal government. If you want to just see what else is out there, then just put in DASH diet. What I'm doing now is going through the outlines of the program, the online classes for controlling high blood pressure without medications. And this will also be a book that will be available through our website. You can currently pre-order it and get a nice discount. The next thing that you can do to lower your blood pressure without medication is exercise. All exercise is good, but some exercise is better than others. The high intermittent intensity exercise, HIIT exercise, is very good at lowering your blood pressure. But you can do things like simply walking. The problem with walking or any other exercise is a lot of times we don't realize how much we actually need to exercise. So if you look at the federal guidelines, walking 20 minutes, 5 days a week will maintain you, but it won't help you lose your blood pressure or make significant improvements. It won't help you lose weight or make significant improvements in your blood pressure. You would have to walk a lot more. But if you want to lose weight, I do not believe walking will help you lose it as quickly as other forms of exercise, like the intermittent high intensity exercises, as well as exercises that help you build muscle. Muscle will also increase your metabolism, help you burn calories, and it can help you lose weight. Let's look at some interesting things that I've found for you, especially for tonight. Now, I'm going to try to jump down to pages 8 and 9 so that I can show you some of the things that I think you'll find very interesting. Let me just stop right here and pause to tell you this other explanation of what causes blood pressure. It's the volume of blood in your arteries that's being pumped from the heart and the resistance of the arteries to receiving that. So, any change in that blood volume or any change in how stiff or flexible your arteries are will affect your blood pressure. So, now let's move down to, oh, well, let's see, I may have to switch over to this and see if I can get down to page 8. Now, this is all the book that's in progress, and this will be available probably within the next week. Class will be available online sometime over the weekend and by next week. So we're going to go to the spices. When we look at the spices, this gets really interesting because there are lots of things out there that people take and they haven't really been shown to lower your blood pressure. This could be because when we look at conventional doctors and the doses that are used in the research for peer-reviewed journals in conventional medicine, the doses aren't the same as the natural doctors would be using. And sometimes these herbs just aren't used in the same manner when the research is done. But the research is showing that this black seed, that's what N sativa is. It's the black seed oil. You can also just get black seed. This will lower your blood pressure, but it only lowers your blood pressure about 5 to 8 millimeters of mercury. The next one, D. glomerata, is also called orchard grass or cat grass. This grass is something that we commonly use in pets. For example, if you have a hamster or a turtle and you go to the pet store, you might see orchard grass or cat grass. If you go to a health food store, however, you might see a tea made from this grass. Orchard grass is the only thing in the herb family that I found that will normalize the blood pressure. Now, this could change by the time the book comes out because I continue to do research for everyone who's interested in lowering your blood pressure without having to take extra medications. And this is a reminder: do not stop taking your medicines without talking to your healthcare provider. And always talk to your health provider before you add any food, vitamin, supplement, herb to your diet. And if you have high blood pressure and you are already on antihypertensive, taking supplements, foods, or the things that we're talking about could affect your blood pressure and cause it to go too low. So you really do need to be working in association with your healthcare provider, a dietitian, or a natural doctor if your doctor is not comfortable with um, using other methods to lower your blood pressure. Because let's face it, no one can know everything, and some people have not learned about natural ways to lower your blood pressure or using foods. So, one of the things I didn't see in my search today is lemon balm, but I have searched lemon balm in the past. Lemon balm is in a mint family and it does lower your blood pressure. It's used a lot in South American countries for hypertension and for diabetes. You can find a lemon balm plant at your nursery. You could probably buy it online. If you have a friend, I'm sure they have plenty of it and can share it with you, because lemon balm is like every other member of the mint family. It spreads throughout your garden. So once you plant it, you usually don't have a shortage of lemon balm. So let's move on to the beverages. One of the ladies in Minding the Temple, which is my online Facebook group, which I'd love for you to check out and see if you're interested in joining, sent me a question. She saw something about beetroot juice. And so I wanted to find out why beetroot juice could lower the blood pressure. Beetroots have nitrates, and what that does is interacts with the endothelial lining of the arteries. Now, that's the very inside of your arteries, and it has to do with how healthy your arteries are. So when you start giving the beet juice, those nitrates can go in there, nourish that lining, endothelial lining, and cause the blood vessel to give a little bit more relaxation, dilating, so that it can drop your blood pressure 5 to 8 millimeters of mercury. Now, you say, well, that's not very much. No, if your blood pressure is 140, 5 to 8 millimeters of mercury is not going to normalize your pressure. But what you want to think about is doing a combination of things. For example, weight loss will lower your blood pressure, but it won't make your blood pressure change very much. In fact, it may only change your blood pressure about 10 millimeters of mercury, even if you lose 10 or 20 pounds. But if you add that to some beetroot juice, you could be looking at a drop of almost 20 millimeters of mercury in your blood pressure. And the amount of beet juice that you should drink is about 8 ounces. At least that's what they had in the studies that I referenced here and in detail in the book. Caffeine is interesting because we always worry about caffeine causing hypertension. Caffeine will spike your blood pressure, but it's only temporary. So you can go ahead and have your caffeine, knowing that it won't cause a permanent elevation in your blood pressure. Now, if you're drinking 5 or more cups of coffee, you have to look at why are you drinking so much coffee? Because 5 or more cups of coffee acts like methylphenidate, which is a stimulant commonly used to help people stay awake, and it also does cause elevated blood pressure. But caffeine in large doses is toxic. It will disturb your sleep, even if you can fall asleep. The quality of your sleep will be different. It will be the quality of a person with a chronic disease. based on your brainwave patterns. Also, excessive amounts of caffeine can cause some problems with your cardiac rhythm and give you some premature heartbeats. So you may want to just limit your caffeine consumption. And if you drink caffeine black, it is considered a superfood because it's full of antioxidants, and some of those antioxidants slow down the onset or the progression of Alzheimer's disease. When you do have coffee, try to get organic coffee because of the pesticides that are commonly used in growing coffee to get those coffee beans. If you want the best type of coffee, then you'll have to get the green beans and roast them at home and grind them up yourselves because when you do that, your beans are fresher and you get more antioxidants and more health benefits. Pomegranate juice is an amazing way to lower your blood pressure. Now, this is not a very sweet juice, and that may be why it's not so popular, but it does have great health benefits. It can lower your blood pressure if you just drink a little bit of this every day. It will lower your systolic blood pressure. If you want to lower your diastolic blood pressure, then you have to drink at least 8 ounces or more a day. And you may see some effects from drinking pomegranate juice within about 2 weeks. Do not stop taking your medications while you are having these foods because these things may not be enough to control you completely, and unless you have continuous ambulatory monitoring of your blood pressure, you could go into a hypertensive crisis without that medicine, have a heart attack, stroke, and even worse, you can die from high blood pressure. Now, here's some foods that are going to help lower your blood pressure. First of all, portion control. Try not to eat until you're so full. I have been told that it's best for us to eat until you feel a little hungry and then stop eating. If you wait a while, you'll find that you'll be satisfied. Sometimes it takes the brain a while to catch up with the stomach. Black powder, like cocoa powder, is good for lowering pressure. Now, I don't like cocoa powder, even if you put it in coffee. But if you do like chocolate, try to get dark chocolate or dark cocoa powder. The leafy greens are wonderful. They lower blood pressure, and it's probably because they're very high in potassium and magnesium, which are two minerals that will help control your blood pressure. Swiss chard seems to have a lot of magnesium, and a lot of people don't eat beet greens. They buy the beets and throw away the beet greens. But if you saute those beet greens and put them with some spices, I like to saute mine with ginger and garlic, they will taste absolutely delicious. You can have your spinach in your smoothie, but you get more benefit from your leafy greens when you put them in a pot, lightly steam them, and chew them. There is something about the bacteria in your mouth that will activate another bacteria and a bacterial process when these leafy greens go into your gut. And what they will do is help that endothelial lining. All berries are good for our health. The blueberries, especially, are good for lowering your blood pressure. Garlic is controversial because there are some societies that don't think we should eat garlic every day. I try to eat garlic every day. I don't always get to it because it's not my favorite herb. I don't like the strong taste. But when you chop your garlic, you let it sit for a little while, and then you get two active ingredients that are going to help lower your blood pressure. I usually try to drop mine into a smoothie so I don't have to taste it so much. Pumpkin. Pumpkin is not my favorite food, and I don't even like pumpkin pie, but I do like pumpkin seeds. And the pumpkin and the pumpkin seeds are good foods to help lower your blood pressure. Of course, you have your beetroots, your walnuts, and flaxseed. Now, you can buy flaxseed milled, but it's better if you get flaxseed and use a personal grinder. Grind up your flaxseed, and put it in your smoothie. Tomato soup is what I'm trying to write here. It's a cold soup that is supposed to help drop your blood pressure. I haven't tried that because I don't like my soup cold, but some people do. Get some fruits that are high in potassium. I like to eat an avocado as often as I can. Yes, it is high in calories, so you want to make sure of everything else you're eating. So when you switch over to your healthy diet and you cut out your bacon, your fried eggs, and 2 pieces of toast with butter and jelly, you probably can get that avocado in because a whole avocado has a little more than 300 calories. I like to drink my oranges. A glass of orange juice can have up to 500 milligrams of potassium, and potassium will help lower your blood pressure. Banana is on the list, but banana doesn't have nearly as much potassium as I like. So if you're going to eat bananas to try to lower your blood pressure, you probably need to eat more than one. Plain yogurt. Now, I'm not a big fan of yogurt. I do like kefir, but if you're going to eat yogurt, try to get plain. It won't have all those additives in it and that extra sugar. Now, here's some foods you want to avoid. Table salt. If you eat a fourth teaspoon of table salt, you will be at the maximum amount of salt intake that's recommended in a day. And even your pink Himalayan salt still has sodium, and having this can raise your blood pressure. Cheese, prepackaged vegan foods or prepackaged meals, your frozen meals, even ketchup. Ketchup is one of those condiments that, hey, who takes out a tablespoon and measures how much ketchup you're getting? But if you did, you find that 1 tablespoon has almost 200 milligrams of sodium. Avoid your lunch meats, and if you're going to eat canned vegetables, be sure to rinse those off to take some of the salt off if you happen to have some that have salt. And then your cottage cheese. A serving of cottage cheese, some brands have 400 milligrams in half a cup. So you want to make sure that you're not eating those foods that are high in sodium. Other things that'll bump up your blood pressure, licorice. Now, I love licorice candy, but I don't eat it because if I do, I just have 1 piece. If you have lots of it, it's known to elevate your blood pressure. Alcohol in any amount will elevate your blood pressure. So if you binge, you're out with your friends, especially when we all go back to normal and we can go outside and hey, you might have 2 or 3 drinks with your friend, you could really elevate your blood pressure. But even just one drink will elevate your blood pressure. So no amount of alcohol is considered healthy if you're trying to manage your blood pressure. Even the energy drinks that some people are using, they elevate your blood pressure. So these are the things that I wanted to talk with you about tonight. And if you have any questions, I will let you unmute your microphone so that you can ask. So I'll tell you a little bit more about the program that will be coming. It's the online course that is going to be available. See if I can show you where that is. If you can see this, this is at drhamiltonstuffs.com store. It's going to take you to our resource page. And at the very bottom, you'll see where you can pre-register to pre-order the book, Lower Blood Pressure Without Medications. And when you do that, you will get an invitation to sign up for our online class if you'd like to. And we'll go into in more depth about the things that we discussed tonight, how to lower your blood pressure without medications. Some of these things may lower your blood pressure only slightly, and you may still need to take antihypertensive medication, but you may not need to take more than 1 pill. And if you are able, you might only be taking an antidiuretic, which is much more economical than some of the other medications. High blood pressure affects us at all ages, usually somewhere in the 30s and 40s. And if you don't get control of it, by the time, if you reach 50 or 60, you will have some serious cardiovascular diseases as complications to high blood pressure. But when I think about being diagnosed at 40 with high blood pressure, and your doctor is telling you that you have to take this medication for the rest of your life, we're looking at 40 to 50 years of taking a medication. So if there's something that can be done to reverse your high blood pressure, I encourage you to try it. Thank you so much for spending some time with me tonight. We have some people on our phone and we have a person online. So this is the end of this presentation. Thank you so much and good night.
Night.
Good night, Ms. Watson. Thank you for joining.
Thanks. It was great.
You're welcome. Thank you for being here. Bye, Miss Parker.